Good afternoon, everybody. Are we ready to get started? Okay. Well, as I said, good afternoon, everyone, and welcome. I appreciate you taking time to attend this meeting on the COVID screening program. We held our first town hall a couple of weeks ago on this program, but since then we've had to make a number of adjustments to the screening program. So we wanted to host the second town hall to ensure you all had the information that you need. So today I'm joined by Dr. Rex Force, the chair of our university's Roaring Back Health Committee, and by Danny Dunstan, chief of staff in the president's office, who has helped lead the screening program efforts. In addition, we have a number of other subject matter experts on the line today to address specific questions as they arise. We also have Jenny Larimore, director of brand management and trademark licensing, who will be serving as our moderator again today. She will put some instructions in the chat now about how to submit questions, how to do so anonymously if you prefer, and then please feel free to go ahead and submit questions as we go. So last week, we announced a couple of changes to our return to campus screening program. First, I'd like to say that the ISU team that planned for and implemented this screening program did an exceptional job. The logistical planning, the systems integrations, and the communications that they developed were superb. I mean, really and truly, they did a fantastic job with this. And they did so over the holidays. So we should all thank them for that work. Now, unfortunately, however, the lab we partnered with had experienced a number of critical issues. First, they ran into a supply chain issue with the vials, which resulted in us having to cancel a couple of days of testing. Following this, they encountered a staffing issue on their end, which resulted in a backlog of processing the samples. This delayed results and had an effect of that backlog kept growing while we continued to send them more samples. The lab has since caught up on their processing, has added staffing to their operation, and the lab has assured us that they have remedied their supply chain and other issues. So to ensure we have a smooth program going forward, we have regrouped with our public health experts, as well as with the lab, to make the following adjustments to our program. First, the program originally required 2 tests in the month of January. This has been adjusted to only 1 required appointment in January. Second, because we had to cancel a few days of screening as a result of the supply chain and the processing backlog issues, we're extending the screening dates out through January 29th. Now, this will be slightly different in Idaho Falls and Meridian, so be sure to check the website for the specific details there. The University Health team has been involved in this decision to adjust our program to only 1 required appointment, and they support this change as still being scientifically and medically sound. They believe that reducing the required sampling appointments at this point does not undermine the positive benefits or the integrity of our program. So we're good there. And starting in February, after we get through our initial round, there will be ongoing screening conducted with targeted populations. This will target populations of our campus, including areas like housing, or in courses with health exception operations, or in athletics, and in programs where we saw spread last semester. So this will help us conduct ongoing screening in those types of areas to promote the health and safety of our entire campus. Plus, those who have an identified need for screening will be able to access one through this program. And again, these are not tests for a known exposure. The program we have in conjunction with the Southeast Idaho District Health Department is designed to address those that have symptoms or known exposures. This is a screening program to continue with the concept of trying to identify those who are asymptomatic positives and get them isolated, hopefully before any further spread can occur. That's what slows the spread and why this program will work. Now, while these changes we made, they're not ideal, the public health experts are confident that the ongoing efficacy of our adjusted program is sound. And last, as I mentioned in my email to campus, the goal of this program is not changing, nor is our commitment to our safety and well-being of our campus community. That remains a constant. You know, often the best laid plans often need adjusting. And in a national environment where hundreds of universities across the country are relying on a very small number of recently developed laboratories doing this work, we will run into difficulties and adjustments are going to be expected. But if we've learned anything about Idaho State University in this last year, it's that we are nimble. We can adjust. And we do so while we remain focused on our mission of education. That's so impressive about this institution. So, in closing, I want to sincerely thank all of the thousands of students, faculty, and staff, and our campus affiliates who have already been screened by part of this program. Hundreds more have appointments scheduled in the coming days. And all of that and all of your support for Idaho State and our mission and our students and us as a community, all of that is commendable. So thank you for that. So now I'd like to turn this over to Danny for a couple of quick updates before we move into the Q&A portion of the town hall. So Danny, take it away.
Thank you. So we have run into a couple of road bumps, as President Satterley mentioned, but here's kind of the key points that you should be aware of. So first, if you have been screened and you have received either a positive or a negative result, you are now fully compliant with the university's return to work screening program. You're good to go. If you had already scheduled a second screening appointment, you may cancel it now by logging into the university health portal. You are welcome to also keep it as scheduled if you'd prefer, but you only need one appointment in the month of January, given the updates to the program. If you have not undergone a screening appointment in the month of January, you will need to log into the online health portal, and Ginny will provide the link in the chat box. And you schedule your appointments to be completed prior to Friday, January 29th. So if you have results, say you got screened January 6th and onwards, and your results took longer than expected getting back to you, or if you have still not seen results, first, we sincerely apologize for this delay. This was the lab issues that Kevin mentioned. There are still a number of lab results that the lab is working to process and report at this time, and we're tracking that issue and trying to get results processed as soon as possible. Given the delay in processing time from when you may have gotten a screening and are still waiting on results, if you'd like to go in and get another screening to get up-to-date results, you're welcome to do that. You just schedule an appointment through the online health portal. Results moving forward should be returned in that 24 to 72 hours time period. And that screening result is just a snapshot in time. We still have all our other COVID-19 protocols, distancing, face coverings, and increased sanitation in place. But you're welcome to schedule another appointment if you would like. So now, if you've received results that say either inconclusive, rejected, or invalid, any of those results, you will need to be screened again. Those results can happen for a few different reasons. They could be from inadequate saliva sample, so not enough saliva in the vial. It could be because there were food particles present in the vial, or perhaps test handling error. Any of those could result in that inconclusive, rejected, or invalid result. All you need to do is go back into the online health portal, schedule another appointment, and be re-screened. It's really important to remember before you arrive at your screening appointment to not eat, drink, including water, chew gum, or smoke for at least an hour prior to your screening. So that making sure that you're not doing those things before your screening will help decrease the number of rejected samples we get back. And then that re-screening process, you'll just want to do that before Friday, January 29th. And finally, the screening program is for students, faculty, staff, affiliates, and contractors with a regular on-campus presence. So if you are working or taking courses entirely remotely, you can fill out an exemption form on the screening program website. On that website, there's more information about exemptions, deferrals, and alternative methods to be compliant with the Return to Campus screening program. So that's just kind of the key takeaways that I wanted to provide at the beginning, and hopefully answer some of those really frequently asked questions. And now I'll turn it over to Ginny, and we'll move into the Q&A portion of the agenda today.
Awesome, thanks, Danny. We have quite a few questions already. So let me start with the first one. After people working from home for health reasons get shots, can they come back to work on campus, or do we wait until there is herd immunity in the fall? And for this, I'm going to ask Rex or Danny if you want to redirect that one.
I'll start.
So this is,
Oh, go ahead, Rex.
okay, that's fine. Sorry, my video is unstable, so I'm not live with my video, but I am here with the audio. You know, we haven't actually developed policies for how vaccination will protect the campus community. Obviously, the vaccine is highly effective, and we expect that over time, the disease rates in the community will decrease. But we will be developing policies and guidance for those who are fully vaccinated in terms of how we will be addressing a return to work protocol. And I think that that's probably where we should leave it at this point.
Yeah, thanks, Rex. I'll just add that we have a team of folks who are working on those decision points and providing recommendations to the university right now. At least for the duration of the spring semester, we will still require COVID-19 protocols, including distancing, face coverings, increased sanitation, skeleton crews, and employees that might be in that situation should work one-on-one with their supervisor to identify the best working situation for their particular unit.
Next up, a specific question. I had my initial test canceled and was asked to reschedule between January 25th to the 29th, but the portal isn't allowing any scheduling between 25th to the 29th of January. Any updates on what we could do about that?
Yes. So right now, we are opening up the schedule. It should be open today for that last week in January. It's kind of a time-intensive process on the back end, but a big thanks to Cindy Rock in Meridian. She has been the lead on that, and she's building out that schedule right now, and we'll make it live hopefully by the end of today, so you can start scheduling for that last week in January. I would note that last week in January, the hours of operation are just a little bit different for Meridian and Idaho Falls. So check in with your campus contact, either Lyle Castle in Idaho Falls or Gabe in Meridian or Ryan Lindsay in Meridian, and they can provide specific details on that. But those schedules should be posted very soon, so you can go in and register. So maybe check back tomorrow.
Excellent. And do we know, Danny, when the manager supervisor link in the portal will be open so that we can check employee screening status?
Yes, we have been working on that and have been running into a couple of those system integration road bumps. But right now, we hope to have that live tomorrow, and then get a campus communication out the following day with instructions on how to access it. So that assumes that everything goes well with our systems integration piece, but we've been working and troubleshooting that and hope to have it live tomorrow.
Great, thanks, Danny. This next question is about the not smoking before the test, and I'm going to direct this one to Rex. Someone asked about vaping. Is that similar to smoking? So I'm assuming this is someone who's volunteered at our drive-through or in-person site. So Rex, vaping, does that count?
That counts. Gum chewing, candy, vaping, smoking, chewing tobacco, any of those things should be avoided an hour before the test.
Excellent. Thanks, Rex. Next question. I'm wondering if we have any information on when we should collect vaccination information from employees. Some of my employees are already being vaccinated at other jobs and are asking me if they need to provide this information to ISU. This is separate from and in addition to the screening program. Rex, I'll hang on to you for that one as well.
So as Danny mentioned, we have a group that's going to be standing up here later in the week related to our vaccine policies. We do know that our electronic health record at University Health can incorporate the vaccine status of all the individuals on campus, much like the saliva testing and screening that we're doing now. So we'll be able to keep those records and be able to exempt people from ongoing screening if that's what the policies are that we develop as we move forward and see more and more individuals vaccinated.
Rex, apologies, you were breaking up that last couple of sentences. Would you mind reiterating the last part of that?
Yeah, can you hear me now?
Yep.
Yep, thank you.
Okay, sorry. What I said basically is that we can collect and catalog the vaccine data that we receive from faculty, staff, and students in the electronic health record, but we have not yet developed policies around how we're going to be either requiring vaccination or including individuals in that whole process as we move forward. So please stay tuned with regard to some of that.
Excellent, thanks, Rex. Next question is, for the second schedule, do we do those in February? The second schedule of screening, Danny?
So you only need to do one screening appointment in the month of January for the return to work screening program. So you do not need to schedule that second appointment. And as long as you have that one before January 29th, you are good to go. After January, once we move into February, the screening program will adjust to target only specific populations. So groups living in housing or specific academic programs where we might have seen more spread last semester. And all those will be targeted communications directly to those individuals. So as long as you have your one screening for this month, you're good to go.
Perfect, thank you.
Question, Tom O'Berry. So we took ours like at the very end of December during the trial run. Some of us did when we were testing our site here in Meridian. Is that considered in the January run?
That's a good question, Tom. No, the way that the system is set up, it's only tracking screening results received from January 6th through January 29th.
Okay.
So if you did something during the trial run, it wouldn't have you listed as compliant in the system. So you should schedule another appointment and provide another sample before January 29th.
I will let folks know. Thank you.
Thank you.
Great, thank you. Next question is related to vaccines, and Rex, you've touched on this just a bit, but if you could elaborate for faculty, are there plans for faculty to receive vaccines? My students, teachers, childcare providers have been getting vaccinated at their workplaces. my colleagues and I are in educational settings doing observations. How should we proceed with getting vaccinated? The health department has not answered my question.
So we are looking at all the different groups, and that the state of Idaho has outlined with CDC guidance for the priorities for vaccination. And those in educational settings, particularly K through 12 education, there's pretty clear guidance there. I would encourage you, if you're in that setting, meaning K through 12 settings frequently, to continue to try to communicate with Southeast Idaho Public Health about the availability of vaccination. In terms of wider planning at the university, as I said earlier, we're still in the process of outlining that and identifying the priority groups for vaccination, and whether that's vaccinations that'll be administered on campus or we will partner with Southeast Idaho Public Health is still to be determined, but we will certainly communicate to the campus community about the availability of vaccine and the groups that should be receiving that vaccine based upon their priority need.
Excellent. Thanks, Rex. A related question. I heard that school staff may be in line for the vaccine. Would this apply to ISU staff, or is it just for K through 12? And Danny, would you mind taking that one?
As Rex mentioned, the state has put a priority order together. Higher education is not considered part of that first wave of those getting vaccinated. It's only K-12 and those in preschool and childcare type settings. So higher ed is not a part of that.
And I think worth noting for everyone's purposes that this wasn't the university's decision. This is the state of Idaho, and many states are making these decisions in conjunction with their federal counterparts. So it's a state level decision. So that's one that we will be in the priority list when the state has so determined. It's not our call.
Yep. And I will say that the advisory group that put together the recommendations that were approved, there was higher education representation on that group with public health expertise. And really, they were looking at the student populations. In a K-12 setting, it's much more difficult to be able to manage those populations and have the right protocols in place. But as we've all seen over the last year, we've done an exceptional job at that as an institution, making sure we have face coverings and we have the proper distancing and student participation in all of that. So that was one of the driving characteristics. If you're an employee or a student that falls within one of the other categorizations, sorry, I can't speak today. You could be eligible for the vaccine, but higher education as a whole is not clumped in with the K-12.
Excellent, thank you. Next question, when we get to this point, do we know if there will be a final deadline for staff or employees to be required to get vaccinated before returning to campus? Rex, any thoughts on that?
So again, those policies have not yet been developed in terms of whether vaccine would be mandatory or strongly recommended, or if individuals would be sort of on their own to get vaccination based on CDC guidance. I will say that there are certain populations on our campus that will, as Danny just mentioned, be higher priority just based upon the state and CDC guidance. And those are people working in healthcare settings. As you know, we have our own healthcare clinics on campus, as well as students that are out in healthcare settings. Many of those students have already been vaccinated by our clinical partners or by public health vaccination clinics. But the rest of campus, we don't have policies developed as of yet. And we're going to be seeking input from the entire campus community on how we put together the vaccination strategy for campus as a whole.
And I want to reiterate on that. Thank you, Rex, that we will have those discussions on campus about that. We'll talk with Faculty Senate. We'll talk with staff council. We'll talk with the student government. We will have those transparent conversations around campus. We'll review the latest medical guidance. And only after we have that type of conversation and look at those issues, will we make final decisions about required vaccinations or not on campus. And no decision has been made yet on that.
Okay, next, if someone attended this meeting late, Danny, can you reiterate for us what to do if we do not have our results back yet?
Yeah, we sincerely apologize. The lab that we partnered with ran into some roadblocks, and there are some results from early on in the screening program that we're still working to get reported out through the system. So as soon as those results are available, you'll get an email and a text letting you know that they are available. However, if it's been a while since that initial screening, and we all know screening is just a snapshot in time, you're welcome to schedule a follow-up appointment. And moving forward, results should be posted within 24 to 72 hours. But we are tracking down the remaining results that have just ran into a reporting issue in the system, and we'll get those posted as soon as possible. But we do apologize. I know that was unfortunate.
Okay, thanks, Danny. Next question. In the absence of frequent testing within the campus community, will the flow of information on cases at ISU be made more robust? My department has had multiple cases among students around Thanksgiving, but to my knowledge, no official information was passed along to the department. Rex, would you mind taking that one?
Yeah, and I guess I'm uncertain as to what additional information should be passed on to the department in this setting. Obviously, we're somewhat limited by the information we can share based upon HIPAA and other guidance. So we certainly notify all the individuals that we know about and their contacts about the need to either isolate or quarantine. And we have done that, I think, robustly throughout the fall, and we'll continue to do that moving forward. We may incorporate some testing to be able to further screen individuals that are associated with these clusters or outbreaks that may occur in a department or in the dorms or in athletics or other settings like that. But we did not, and we will not, as a matter of routine, inform people that that are not part of the outbreak or part of the exposure. Again, if we need additional information, I would encourage people to use the self-report form, and a member of our contact tracing team will reach out to you and will clarify your level of exposure, your level of risk as it relates to any cases that are within your department or living situation.
Great, thanks, Rex. Next question, Danny, if I can lean on you for this one, please. If someone has had 2 invalid results, what should they do next?
Really, you can, the only thing to do is to get screened again. The invalid results can happen for a number of reasons. When you go in for your screening appointment, really be cognizant of that 1 hour time frame ahead of your appointment where you're not eating, drinking, even water, chewing gum, any of that. If you've had 2 invalid results, maybe stretch out that time a bit. And then be cognizant of how much saliva is going in the vial, that it's within the range. Too much can be a problem if you're full to the brim, as well as if you don't provide enough saliva. So those are the things that are within our control to be able to make sure that we have a sample that the lab is going to be able to process. There are a number of things outside of our control when the lab goes through and processes the result. that's scientific in nature and over my head. So I'll defer to Rex if he has any additional information on that. But those are the things that we can really control to make sure that the samples that we get and send to the lab are going to be viable for processing. Anything to add, Rex?
No, I think your response was spot on, Danny. We want that sample to be between 1 and 1.5 mils, which is about halfway up that vial that you'll be handed at the screening site. And as Danny mentioned, we don't want it overfilled. We had, I think, more problems with people underfilling, but we want to make sure that it's 1 to 1.5 milliliters in that vial.
Great, thank you both. Next question, do you expect required vaccination discussions to take place soon, or do you have any general timeline for when they will take place? Danny, if I can lean on you for that answer.
Yeah, so as Rex mentioned, we have a group meeting this week to begin rolling out this program, or not rolling out the program, but beginning the work. So kind of a rough overview of what we're hoping for a timeline is to use the month of January to really solicit the feedback from campus about how groups are feeling about vaccinations, requirements of vaccination, to collate that information, have the health committee do a thorough review of the scientific literature available, and then hopefully by March and April to be able to have a kind of a program rollout ready to go. As Rex has mentioned, the timeline for vaccination doesn't have higher ed in general identified as a group that will be anything other than kind of the general vaccination population that will happen later in the spring. So that's when we hope to have those larger campus rollouts happening. There might be some specific questions that we answer a little bit sooner related to, students that might be out in clinical site rotations right now, or different things like that. So Rex, anything to add?
No, I think we're going to be, as we put these recommendations together, we'll be following state and federal guidance for priority groups, and obviously engaging the campus community as we've talked about and President Satterley mentioned earlier.
Great, thank you both. So there has been some confusion on whether or not you can drink water before you do the test. And as Danny reiterated in her beginning remarks, water is definitely not allowed before you get your screening. Is there anything else like this that we should consider? The question specifically is chapstick. Would something like chapstick affect it? Rex?
So I think it's possible that chapstick could affect it because there could be particles, even small, even nearly microscopic particles of paraffin, of the different waxes that are in lipstick or chapstick. And I'd recommend, because we've seen quite a few tests be returned as inconclusive or rejected, I'd recommend that folks not wear chapstick, not wear lipstick or lip balm, and that they adhere to all of the other recommendations that we've made. No eating, no drinking, no vaping, smoking, chewing tobacco, none of those things in the hour before they come in and test.
Thanks, Rex. One of our volunteers has commented that a lot of people might feel self-conscious when they're taking more than a few minutes to fill their vial, and that they recommend telling people it's a no judgment zone and not worrying about how long it takes. And as someone who's worked the drive-through a couple of times, I can say that's definitely a good idea, especially for the drive-through as you're sitting in your car worried about people behind you having to move, just making sure that they know it takes as long as it takes and it's no problem. Just wanted to pass that feedback on. Anything to add to that, Rex?
Yeah, I would just say that it's common for people to take 10 or 15 minutes to get a sample. And when I've worked the testing center and roamed around amongst the groups, you can see that some people struggle getting a sample deposited in a short period of time. It's perfectly fine. We also have a couple of options for people who are in that setting. We do have some sort of private booths that are available for people if they'd like to step into those and be in a more private area. They also, some people might feel better sitting in their car and going through the drive-through in terms of being able to produce that sample. I think after you've done it once, you'll feel better going again if you're in one of those groups that we talked about for follow-up testing later in the semester. For those that are still going through their first time, absolutely, it's a no judgment zone. We want people to do and take as much time as they can to provide a good sample. And that's what I talk to people about. Take your time, produce a good sample, and then you won't have to come back and do it again.
Excellent, thank you. So I believe that's all the questions we have in the chat or on YouTube. So I would love to turn it back over to Danny and Kevin for any final remarks. Thank you.
I do have one final remark. If you could just help spread the word about the adjustments to the screening program, that you only need one screening appointment in the month of January with either a positive or negative result. Those inconclusives, rejected, invalid, you'll have to be rescreened. But in general, that you just need that one appointment in the month of January to be compliant with the return to work program. Spread that to your colleagues. If you're a supervisor, to your teams, if you're a student, to your friends and classmates. We want to make sure that people understand that. You're welcome to get more than one screening and schedule that through the online health portal, but only that one is required. So whatever you can help spread the word, we'd appreciate it.
And I want to pass on a story that one of our staff members told me recently. They said, I want to thank the entire university for all the efforts we have done, this screening program that is working, what we've done with face coverings, social distancing, online education, skeleton crews, having people telework. They said, I'm in a situation where I don't always feel safe when I'm out in the community, but I feel safe when I'm on campus because of the measures we have taken. This screening program is one more measure, and we are implementing these because we are keeping our campus community as safe as we reasonably can given the circumstances. So many things are beyond our control. This pandemic is beyond our control. What goes on in the community, what goes on in other people's labs is beyond our control, but we can control what we do and how we react to it. And I have been so proud of this campus's reaction and the way all of our campuses have responded, have taken up the mantle of doing the right thing for the right reasons. That makes me proud of us. And what we're doing with this screening program is one more tool, in addition to the things we're already doing with face coverings, social distancing, telework, online. We are doing the right thing, and we will continue to do the right thing. And as such, when we get past this pandemic, and we will, and when we have vaccinations and we're ready to return, we are going to be all the stronger for it because we went through this together. So thank you all again for all of your support. Thank you for everything that you do for this institution and for our students to help us accomplish our mission. Thanks, everybody. Thanks for joining us, and have a great day.